Polynucleotides, they're one of the latest crazes in aesthetic medicine, and lots of clinics are offering them. They're supposed to be natural, rejuvenating, repairing and hydrating, but do they really work? I'm Dr. Owen Thomas, I'm an aesthetic doctor in London. I'm going to tell you how they work, what are the indications, how you use them, and are there any risks or side effects you should be aware of before using them. So what are polynucleotides? So you've probably heard of DNA. That's the spiral structure within our cells. It's the building block, the blueprint of how we are made. So the building blocks of DNA and RNA are called nucleotides, and when you put lots together, that makes polynucleotides. Polynucleotides have been around for quite a few years, but it's only the last few years where their aesthetic benefits have been realized. Before that, they were used in other things like wound healing. Currently, we get most of our polynucleotides from fish. That's because it's relatively easy to obtain, and fish DNA and RNA is relatively biocompatible. That means our bodies accept it without mounting an immune response. Unfortunately, that's led to the term salmon sperm facial, which is where it comes from. As you can imagine, there's lots of companies now starting to release their own versions of the products. I use a company called Mustelli, who produce a product called Planest. They've got fish farms and they produce this in a humane way. So what are the basic ways that polynucleotides work? So one of the main factors is that they go underneath the skin and they stimulate fibroblasts, and they increase the number of those cells underneath the skin. These are collagen-producing cells. They also produce an elastic protein called elastin. And as well as stimulating them, they actually increase the number of cells underneath the skin, so there's even more cells producing collagen. As you probably know, it's so important to get collagen back in the skin because we're losing that about 1% per annum from the age of 20-25. One small good bit of news is that fibroblasts, those cells that produce the collagen, they can be stimulated well until we are about 75 or 80 years of age, which is great news for rejuvenation. There are also some other good ways that polynucleotides work. One of those is increasing blood vessel growth. Small blood vessels in the skin, they upregulate growth factors, and these small blood vessels are essential for bringing nutrients to the skin, but they also give the skin a glowing, shiny, healthy appearance. And the anti-inflammatory effects that they have are very important because they reduce the substances that break up collagen. So in effect, we're increasing collagen production and we're reducing the degradation of it. So what are the benefits of polynucleotides? So you can probably guess some of these from the information I've given you, but it's great for fine lines and wrinkles, skin hydration, making the skin look generally healthier. It has a slight volumizing effect, but if you've got a significant loss of volume, there are other treatments which might be better. So these benefits are particularly important in hard to treat areas, and I'm going to talk about that in a minute. One relatively new concept is called priming, and this is where we use polynucleotides into the skin in preparation for other treatments, preparing the skin by increasing the amount of cells ready to produce collagen. And this is great for using before Morphisate or HIFU or Sculptra, Hypertonic Radiesse or Jali Pro. So the schedule for polynucleotide treatment is normally about 4 sessions. They're spaced about 3 to 4 weeks apart, so a relatively short gap, and we don't see the benefits fully for quite a few months like all collagen treatments. Based on the evidence that we have, it seems that the maximum collagen is probably around 3 to 4 months after a course is finished. One of the great things with collagen production and collagen treatments is that the benefits are usually very long lasting, several years, because we're producing a natural product that's in the skin and it only degrades at the natural rate. Having said that, it's good to have a top-up, and it's such a straightforward treatment that most people have a session or 2 every year, at least after the initial course. As I mentioned earlier, it's quite straightforward to treat. We can use a needle or a cannula, and while I love cannulas, in this instance I use needles because it gets it right into the skin where we want it to work. Cannulas are very comfortable, less bruising, but it's going to be underneath the skin, and therefore the product's going to have to diffuse upwards to have its maximum effect. So there are lots of amazing collagen treatments available, but one of the standout things with polynucleotides is that because they're so easy to use, you can use them in hard to treat areas. Some of the areas we would use would be under the eyes. That's a notorious area which is quite difficult for some people. The décolletage, the neck and the hands. We can use it for mild to moderate hair loss, scar and stretch mark rejuvenation, and even in the vulva for ladies who want a gentle natural rejuvenation and hydration in a delicate area. So are there any risks or downsides? There's always potential complications with any aesthetic treatment, but it's pretty low with this class of medicines. We've got the usual injectable ones like bruising, bleeding, but that's pretty minimal, redness, itching. Allergic reactions seem to be very low because of the biocompatibility with the substances I mentioned earlier. So we always think of vascular occlusion when we're injecting underneath the skin, but because we're injecting into the skin generally, especially with needles into the skin where you can see it, the chance of injecting into a large blood vessel is virtually zero. There's a very small risk with cannulas, but these substances are a bit thinner, so I don't know as yet of any serious vascular occlusions that have occurred with polynucleotides. I've had polynucleotides and I haven't had any issues with them whatsoever, but I have found that some people, particularly under the eye and with a very fine blood vessel circulation, can have a little bit of bruising even with the small needles that we're using. So is it any better or worse than some of the other collagen treatments? So it's a difficult question to answer because there's not a lot of evidence, but we can extrapolate some things from studies. I've got a video coming up in the next few weeks about collagen treatments and how they work and which ones might be better for certain indications. Polynucleotides might be better for a localized, delicate area where it might be difficult, for example, to use Morpheus 8 or to get a cannula in to use Sculptra or Radiesse. We know that it improves skin quality and skin health in multiple ways, but it's probably less collagen building than Morpheus 8 or Sculptra, for example. It's definitely less volumizing than some others, so if you've got some volume loss in the face but you want to improve your skin health, then Sculptra might be a better choice. If you want to rejuvenate the whole face and neck, for example, large areas of skin, then you might opt for radiofrequency because that gives a diffuse blanket covering of the skin. There was one small study which did show that the elasticity from polynucleotides was almost as good as Sculptra, but it was less volumizing, which is what we discussed already. One thing I would say is that if you've got significant volume loss, particularly if it's in one area that can be targeted, don't be afraid of dermal fillers. When it's done properly and naturally, that can really be rejuvenating. It's also important to get the skin health good over the top with collagen building treatments, but dermal fillers still have a significant place and they just cannot be replaced for some things. I mentioned earlier that they can be used on the backs of the hands. One of my favorite treatments for this is something called Radiesse. I've got a video on Radiesse and how that works on the backs of the hands, and you might want to check that one out. So I'll see you in the next video.